Blood transfusion, overview and protocols. Blood transfusion is a medical procedure in which blood or blood components are transferred into a person's bloodstream. It is performed to replace lost blood, provide essential components that the body lacks, or treat specific medical conditions. Types of blood transfusions. 1. Whole blood transfusion, used less frequently today, indicated in cases of massive blood loss where all components of blood are needed. 2. Component therapy, red blood cell, RBC transfusion, treats anemia or blood loss. Platelet transfusion, used for low platelet counts or dysfunctional platelets. Plasma transfusion, administered to manage clotting disorders. Cryoprecipitate transfusion, contains clotting factors like fibrinogen and factor VIII. White blood cell transfusion, rare, used for severe infections in neutropenic patients. Indications for blood transfusion. 1. Acute blood loss, trauma, surgery, gastrointestinal bleeding. 2. Chronic anemia, iron deficiency anemia, thalassemia, or sickle cell anemia. Clotting disorders, hemophilia, disseminated intravascular coagulation DIC. 4. Cancer treatment to counteract chemotherapy-related cytopenias. 5. Severe infections to manage thrombocytopenia or severe sepsis. Blood transfusion protocol. 1. Pre-transfusion protocol. Medical evaluation, confirm indication for transfusion, assess patient history, including any previous transfusion reactions or allergies. Blood typing and cross-matching. Perform ABO and RH compatibility tests. Cross-match the donor's blood with the recipient's to check for any incompatibility. Informed consent. Explain the benefits, risks, and alternatives to the patient. Baseline observation. Check vital signs, temperature, heart rate, blood pressure, respiratory rate. Pre-medication, if needed. Administer antihistamines or antipyretics to patients with a history of mild transfusion reactions. 2. During transfusion, verification. Match the patient's identity and blood product with the transfusion record. Double-check the product's expiration date and appearance, free from clots, discoloration. Administration guidelines. Use a sterile blood transfusion set with a filter. Transfuse at the appropriate rate, typically over 2 to 4 hours for RBCs. Start slowly for the first 15 minutes to monitor for adverse reactions. Monitor patient. Reassess vital signs every 15 to 30 minutes. Watch for early signs of transfusion reactions, e.g. fever, chills, rash, dyspnea. 3. Post-transfusion care. Observation. Monitor the patient for delayed reactions, e.g. fever, jaundice, or hemoglobinuria. Repeat vital signs after the transfusion. Documentation. Record the type and volume of blood transfused, transfusion start and end times, and patient's response. Laboratory tests, if indicated. Post-transfusion hemoglobin, hematocrit, or coagulation profile. Potential risks and complications. 1. Allergic reactions. Rash, itching, or hives due to sensitivity to proteins in donor blood. 2. Febrile non-hemolytic reaction. Fever, chills due to recipient's reaction to donor white cells. 3. Hemolytic reaction, destruction of RBCs caused by ABO or RH incompatibility. 4. Iron overload, frequent transfusions may lead to excess iron deposition in organs. 5. Infections, rare, but includes risks of hepatitis or HIV, reduced with modern screening techniques. 6. Fluid overload, particularly in elderly or cardiac patients, leading to pulmonary edema. Special considerations. 1. Emergency transfusions. Use O-negative blood if the blood type is unknown. 2. Irradiated blood. Prevents graft versus host disease in immunocompromised patients. 3. CMV-negative blood. Used for newborns or immunosuppressed patients to prevent cytomegalovirus infection. 4. Autologous transfusion. The patient donates their blood prior to a scheduled surgery. Conclusion. Blood transfusion is a life-saving procedure, but it requires strict adherence to protocols to ensure safety and efficacy. Regular training, vigilant monitoring, and comprehensive patient care are vital components of the transfusion process.